Hello and good afternoon. My name is Rebecca Farron, and this is my intervention, presentation, and capstone reflection video. My proposed intervention was a medication assessment, a diet specific for COD patients, and lifestyle changes. The PowerPoint provided to the patient explained medications that can be taken to improve the quality of life for this patient. The patient takes some of the medications provided, but was unsure about the others I had educated her about. I helped her understand how to eat foods, good, nutritious foods. I explained to her that the body receives nutrients from food, such as carbohydrates, fats, and proteins. I taught her that you could breathe better if you consume greater amounts of fat and fewer carbs. For every unit of oxygen that is utilized during the metabolism of carbohydrates, the human body generates a greater amount of carbon dioxide. The human body makes a small amount when it breaks down fat. She stated that she understood and would make better choices. I knew that she understood what I was telling her because when dietary came around to ask her what she wanted for her meals for the next day, she stated that she wanted sausage and eggs and water to drink with fruit on the side for her breakfast. For lunch, she opted for a grilled chicken salad, and for dinner, she asked for grilled salmon, broccoli, and fruit on the side. I also showed her on her smartphone that she could look up foods and nutrition facts and how to count carbs. As far as her lifestyle change, she quit smoking about 8 years ago, but lived a very sedentary life. I educated her on the importance of daily exercise, and I explained that despite the fact that you may believe that it is not safe or feasible for you to even get active while you have COPD, the correct kind of quantity of activity offers numerous advantages. Prior to beginning a fitness regimen, consider the most suitable activity objectives for you in conjunction with your healthcare provider. I taught her that it is crucial to avoid going overboard when she first committed to this exercise regimen. Overly prolonged or vigorous exercise may result in harm, breathlessness, or other COPD-related symptoms. I told her to enhance her physical activity time steadily if she doesn't exercise frequently. Everyone should have various fitness objectives. Individuals with COPD should generally engage in moderate physical activity for 3 to 4 days a week for 20 to 30 minutes. She decided to walk around the unit that afternoon, so I knew that she had paid attention to me. She responded, "Well, you told me to get more active, didn't you?" When questioned, "What are you doing out of bed?" She carried on walking as we both chuckled. She claimed that she had a membership at a gym close by and would visit it with her son. I told her that simply pacing around the house, yard, or neighborhood is sufficient, and I demonstrated how to find exercise videos on YouTube using her smartphone. Use of evidence and peer-reviewed literature to plan and implement the project. I conducted a reliable sources search using the Capella University's library's Summon database to make sure I gave my patient the most up-to-date information possible. Peer-reviewed articles that were released within the last 5 years constituted my search parameters. I also looked for trustworthy COPD-related websites on the internet that ended in .org, .gov, or .edu. I carefully reviewed every source to ensure that it was pertinent to my issue and plan of action. Healthcare technology to improve outcomes and communication. There is new technology that was created and works through the digital mobile phone app COPD.PAL in collaboration with medical professionals to aid people with COPD in managing their illness, NOx 2021. This app offers flexibility and availability. The purpose of COPD.PAL, which functions similarly to a traditional journal, is to enable patients to have more control over their condition and give medical experts precise, individualized information throughout clinical sessions. My patient was previously familiar with this technology and also gave her information on telehealth and encouraged her to check with her pulmonologist to determine if this was possible. She is unable to drive, therefore it is difficult for her to get transportation from her home to appointments, so I thought telehealth would be helpful. She had been in and out of the clinic practically every week for a period of time due to exacerbations preceding spending time in the hospital. So telehealth would be beneficial. Health policy influences standards and policies. The rules and regulations established by the State Board of Nursing Practices set forth how nurses ought to operate, what makes them eligible for licensure, and what does not. These guidelines and practices ensure that individuals, especially those with COPD, obtain proper treatment from qualified medical professionals, working certain that individuals, especially those with COPD, obtain proper treatment from qualified medical professionals who work in a secure environment. The State Board of Nursing establishes this nurse's scope of competence, Lockhart 2020. The American Nurse Association, or the ANA, defines the scope of practice as the services which a licensed nurse is considered qualified to do or is allowed to provide under the terms of their licensure, Lockhart 2020. According to Jacoby and Scruth, 2017, nursing professionals have to preserve their competency during their employment. To function properly, nurses need a number of essential components in position, including an organization for accreditation and licensing, authorized trainings that fulfills a minimum requirement, and a code of ethics that acts as the cornerstone for what they do every day. Jacoby and Scruth, 2017. The Code of Ethics serves as the cornerstone of the field of nursing and directs nurses' choice and deeds. The moral guidelines set forth in the Code of Ethics remain inviolable in all capacities and situations. Professional nurses have to be aware of the Code of Ethics, take responsibility for responsible nursing acts, and constantly practice inside the licensing authorities in their employment states' regulating authorities. Specified limits on the practice. Jacoby and Scruth, 2017. A nurse is required by the Code of Ethics to demonstrate empathy for the COPD patient and uphold their right to privacy, to be dedicated to their requirements, security, and wellness, and to keep up with the most recent developments in COPD study and technological advances and will enhance the patient's results. Jacoby and Scruth, 2017. Project predictions and outcomes. My expectation for Sally Jane is that she will keep to the strategy that we had discussed, relying on her own willpower and the assistance of her family to manage her flare-ups and follow her dietary and physical activity regimen. Since the beginning of the initiative, I have noted that the patient had made better dietary and exercise-related decisions. She intends to join a gym with her supportive son, which will hasten her recuperation and save additional hospital visits. Personal and professional growth throughout the project. Due to the fact that I had a little child at home who required my attention, my goal for this program was to complete it as quickly as possible. I can now say that I was successful in completing it. I was very intimidated when I first started the program and was worried that I would lose track of the task and become confused with the directions that were provided. After doing my first evaluation and receiving an excellent grade, I felt motivated. However, after reviewing the instructions and calming myself down, I discovered that it was not really that difficult and that I was just overcomplicating it myself. I focus on improving my teamwork and communication abilities now because of this curriculum. I can also decide which leadership position I should play depending on the circumstances when it comes to the patients that I care for on a daily basis. I've been encouraged by this program to constantly keep a strategy established and to pay attention to the smallest details. This program has evaluated my capacity for self-motivation as well as my capacity to demonstrate to myself that I possess the dedication and skills necessary to advance my education. I have the impression that in order to effectively complete this program, desire and tenacity were required. I am happy to be able to add Capella to the list of educational institutions from which I have graduated. Thank you.